everyone. Good morning to the drive. I'm going to hop in on nutrition. Several of my patients who have read my book and then came to Austin are wondering why we no longer give gift cards to The Well in Westlake, which is the restaurant near my office that is gluten-free, dairy-free, and seed oil-free. Just right off the jump, we found that people weren't utilizing them, so that's why we discontinued the gift card to the restaurant. But we'll work out a separate arrangement with them. I was at the restaurant last night. Actually met up with a couple of colleagues and actually a patient and their family. Had a good chat. Great meal. So it's how food. It's really how we should eat, like whole foods. Really avoiding ultra processed food. So let's dig into that, right? Ultra processed foods, things that have a bunch of preservatives in them to keep them on the shelf longer, or a bunch of added sugar. So that's really the culprits in, a lot of poor behaviors. We may have a genetic predisposition to, if you want to think of it like binging or not feeling satisfied. So one kind of simple tactic for this always is to include more, dietary proteins. And this is not an indictment on any type of diet. I find that the folks who are following a more vegan and then vegetarian diet have difficulty getting enough protein in. And then I have folks who are pescatarian. They get a lot of lean protein. And then anybody who's on more of a animal-based diet, there's all sorts of diets. I don't really care which diet you're on, as long as you're getting enough of high-quality protein in the diets. And I know it seems like a lot, but if you just think of like a pound of body weight, so if you're 150 pounds, 110 pounds, 105 pounds, I have people try to eat that amount of grams of protein, so 100 grams, 110 grams. So you're trying to get about a gram of protein per pound of body weight. That's higher than average because I want people to, number one, work on getting that amount, because it's always hard to achieve that amount. You may use like a MyFitnessPal tracker for macros or something, and I had actually never done that, and then I took a little challenge from a group I was in just to check your macros, which I had never done in my life. And it is a good way to help you keep track of them. I didn't do it to count calories. I don't have that as a recommendation. So I just concentrate on you getting enough protein in your diet. And so we want to start all those things before surgery. So these are all habitual changes. So we'll talk about, diet and increasing your dietary protein. I do ask people to cut out gluten and dairy. I would recommend using and cooking in things like extra virgin olive oil and avocado oil to avoid any problems with seed oils. The kind of things that are maybe harder to appreciate are the ultra-processed foods that have added sugar. So cutting that out is probably harder. If you're used to maybe taking things with you that are in packages or bags to work for lunch or something like that, it's just going to take effort where you may be cooking more on the weekend. I'll tell you what I do. I wouldn't say it's for everybody, but we go to a farmer's market and we purchase like different types of burgers from a local farm. They don't have fillers in the burger, so they cook really quickly. They actually thaw and cook really quickly. And from this farm, we can get beef, lamb, goat, chicken, all of which are very good. And we got a little Ninja air fryer. We broke down and got one of those, and it's got the stackable, trays. So I just, for 20 minutes on 390, cook 4, burgers of whatever variety of meat, and I just cook a bunch of those up, and I put them in Pyrex. I don't reheat anything in plastic ever, because I want to avoid phthalates and microplastics. So I don't ever reheat anything in plastic. I don't own any plastic stuff anyway. And I just carry that stuff with me. I carry fruits. I probably on a whole don't eat much in the way of vegetables anymore. I can do better at that. And then everywhere I work and at home, I have the same basic 3 things. I have an amino acid powder, I have creatine, and I have a plant-based protein powder from our line that's made out of pea protein, and a frother, whether it's at the surgery center or at home or at work. And I just make little basic protein drinks or amino drinks and use the frother. It actually works better than blending, and that's a great invention, the frother. And so I've really pared down things in the diet and tried to make it simple for both myself and for my patients by expressing the need for increased amino acids and dietary protein. A little scoop of amino acids in our program is about 15 grams, and then depending on the scoop of the protein, it's always between 20 and 30 grams. So those are ways to increase and get that 100 if you're a smaller patient, up to 150 if you're closer to that weight, and then eating how I described. And then a lot of people were asking about vegetables and salads and things like that. Those are all fine. They're not going to make you feel like you had a lot to eat, and that's fine for getting fiber. I like fruit as a source of fiber above all else. Fruit tastes good, so I have always apples and bananas and tangerines and oranges, and when the stuff's in season, nectarines. That's probably my all-time favorite fruit. So nectarine from growing up. Pomegranates, love pomegranates. So I just carry that stuff around. It's not really difficult. So I'm up at 4:30 in the morning on Tuesday, Thursday, going to the surgery center. I had already prepped those things on the weekend, and so I grabbed the Pyrex and load up a little lunch bag and some fruit and other stuff and go. So it's about structuring and making tiny habits that become cumulatively big changes in your day-to-day. So if that becomes your routine, then that's what you're going to do. Much like going to bed at certain times, which is the other kind of tip I can give you, is if you have already got a lot of digestive issues, you need to give your body some time to rest and recover and digest your meals. So try to back your meals up further away from when you go to bed. I'm really a proponent of trying to get that about 3 hours before you are going to go to bed. Stop eating, stop drinking a couple hours before you go to bed. This way you're giving your body time to better digest. And then if you have trouble where you got to wake up at nighttime and go to the bathroom, this gives you an opportunity to do that before you go to bed, either once or twice, depending on when you last drank. And I don't think it's controversial, but just reducing your use of your phone. Not so much as it relates to blue light. I'm sorry, but just the interaction of the phone and the applications and the screen time. So on your phone, you have settings, and one of them is screen time, downtime, and then you can set downtime to just shut off your phone, basically, except for like the phone, which is the thing we all grew up with, was just a phone, and not all the different applications. I started doing this on my phone. It's been really helpful because it just shuts it off, and then I really can't do anything with it. But you got to be consistent, and not have your little cheat moments. I do that from time to time where I got to look something up or what have you. But it does help you kind of claw back your time from your phone. So like the discussion about food is a big one. Many patients, including one I talked to yesterday, they have problems with and have had problems with their GI tract for long periods of time. And one patient in particular told me they'd have problems since they were 15, and they chose that time. And if you have a time point like that in your life where you go back and you can pinpoint very easily the time frame that happened in, you got to go and look at corresponding events or anything that was abnormal at that time in your life. I always look for big events, like somebody moved or there was a problem at the home they lived in or where they slept, looking for exposures to problems with bad groundwater, bad air, mold, any kind of environmental toxin, travel issues. Somebody could have got on a trip a case of what they call traveler's diarrhea, which may be from a number of things. It's basically food poisoning, and that could be from a parasitic infection. You could have overgrowth of Entamoeba histolytica. There are all sorts of things that can happen that we don't necessarily correlate our symptoms with, and then over time, this person in particular had problems with chronic, and still has problem with chronic constipation, and takes Linzess, which is a medication, and we don't want anybody to have to take a medication in order to have a bowel movement. I have patients all the time who have problems with just frequency of eliminations, and they'll want to take something simple like aloe, and that's a very easy thing to add in. I find it more important for them to increase both the soluble and insoluble fiber in their diet, so things with psyllium, that's going to help them. So that's what, and psyllium, that's a fiber you'll find in a lot of fruits, and then something like celery with all that stringy stuff is more insoluble fiber or pectin. So there are a lot of ways to help, but like making these tiny habitual changes will help you for sure. Other little tips and tricks that go along with how you really improve your diet is drinking out of, you've heard me say this a bunch of times, glass or stainless or ceramic, just to avoid additional phthalates or microplastics. And then air quality is a big thing with me. I live in Austin, Texas. We have a high amount of just allergens in the air. We have oak and we have cedar and we have high mold counts. The weather here is most of the time pretty temperate. Doesn't really freeze, and then that just allows the trees and everything to just produce more and more pollen. And then if there is a freeze, once the freeze is over and the trees recover, it's a real difficult time in Austin. We recently had this. happened to us, and for the weeks after, it's been nothing but eye burning and allergy type symptoms with runny noses and things like that. So we recommend the use of a separate air filter in your home. I've used Austin Air, IQ Air from Switzerland, and currently use Jasper.co air filters. All of those are very good. The Jasper.co actually adjusts to the quality of the air, so if you want something super specific, really quiet, really nice looking, it's their products best for that. Going back to fluid quality, I had somebody tell me they were really, because of the water quality in their area, they were drinking a lot of bottled water, because they had gotten a notice from their city that their water was not good in terms of, or not high enough in terms of quality to drink. There was a contaminant. So in those situations, you always got to, obviously put your health from first and foremost. That's the priority. You can get systems put in, home filtration systems, so those are important, and we actually put one of those in our home for water quality improvements. If you use an RO system, you got to put minerals back. So there's lots of ways to do this, and you have to do what fits into what you can afford. And these are all the basics. I'm not talking about adding a specific, system to put back water or to add anything, to the water, like hydrogen or something like that. That's what I was getting at. But just, filtered water. I would say that, it's a tip that I've had to take to heart because I drink so much coffee. You want to work at having mold-free coffees. So there's Danger Coffee, there's Life Boost, Keon. There's different coffees that are, inspected and analyzed and made sure they don't have and are free from toxins. So that's important for sure if you're drinking a lot of coffee like I do. I drink a lot of coffee. So these are just, nutrition's paramount, sleep, air quality, fluid quality, food quality. If do your best to get what you can based on your budget in terms of food quality. So obviously organic is not a perfect, but we feel like that's a better option. So try to get those things in terms of fruits and vegetables to the best of your ability, and then grass-fed, grass-finished beef, wild-caught fish, and free-range, hormone-free raised chicken. If those are kind of your basic things. If we got a farmer's market, I would check those out. Sometimes you can get really nice deals from the farmer's market if you have that opportunity.